The facelifts that I do are in a hospital with some kind of anesthesia, but how much anesthesia that is up to you and the anesthesiologist. And generally that decision is made by your health status. That said, if you snore, if you have a really heavy neck, putting a tube down and putting you under anesthesia in that way is actually a safety thing. And it makes it more comfortable for you, because then you go to sleep and you wake up and the surgery's done. Running surgery under a little bit less anesthesia is totally doable, and I will absolutely do that for the right patient. But it really depends, again, on your health status and what the anesthesiologist thinks is the absolute safest thing. I say this all the time. We are doing surgery electively, stuff we want to do, not stuff we have to do. And because of that, I want to do it the absolute safest way possible. And if that requires general anesthesia, it may need that. And granted, general anesthesia for this is very different than general anesthesia for like open heart surgery. This, it's barely anything at all compared to open heart surgery where there's paralytic medicines, all this other stuff going in. So it's kind of a different thing. And I'm always happy to talk about that with any of my patients if they're concerned about general anesthesia. Also, pretty much anybody that's having a facelift is also going to need a risk stratification by their primary care doctor. That really just says that primary care doctor says that you are as healthy as you possibly can be for our completely elective surgery, whatever that means. Do you need an EKG or whatever? That's up to them, and they kind of say that you're as safe as you can be for the surgery.